wanted to start out with understanding kind of what the size is for this group. So if you look at these, they range between, some of these groups have 10,000, 15,000, 6,000, 4,000 members in it. But for a group of 40,000 to have 15,000 members in just one of these groups, that's substantial. If you're trying to locate your target audience, this is where they are. They're in these groups, and some of the people are in more than one of them. And what's also interesting, and when you see these slides closer, you see that there's 23 or 25 posts a day in these groups. These are happening places. There's a lot of information being communicated. So what are they talking about? And this is where it really gets fascinating from a pharma perspective and from a treatment perspective as a whole. They're talking about, and what's one thing to point out is the vast majority of these groups actually enforce medically credible information and sharing your sources versus opinions and poor medical advice. So the quality of the interactions in this group is really quite good. They will often share physicians lists of physicians that specialize in treating this or that are good at it. They will talk about what you're allowed to talk about, what you're not allowed to talk about. They will also talk about the treatments. They'll talk about the drug, as we looked at the numbers before, they'll talk about the treatments that are upcoming. There are robust conversations about pipeline happening in these all the time. So if you're a year out from approval from PDUFA, this is where you need to be paying attention because they're going to be talking about you. They also will talk about not only treatments that work for them, whether they switched to a new drug, what their experience was with the new drug. They'll also create materials and functionally identify and save the best, most credible information from the rest of the web. So you'll see in the documents in these groups, they'll have links to credible information. They will crowdsource the best research for anybody who follows them. It's remarkable. And in this condition, one of the things that can get you in big trouble is if you have an emergency medical situation. Let's say you're in a car accident, and some of the things that the EMS and the ER teams will do will actually send you into a myasthenia crisis where you can't breathe. So they've actually gone so far in this condition to create wallet cards, educational binders that you can give to a new physician, and they crowdsource all of this and then share it back. So the value to a new patient is absolutely astronomical to these groups. And they have done a really great service. Some are sponsored by associations, but most of them are just people who gathered with interest and need around these type of situations. So I think sometimes we discount these groups and the value they play in the patient journey, and also the depth of information and sources of information they have. Now, one of the other functions that the groups will serve is many times they have a myriad of physicians in the group, and they will serve as a translator. They'll take the studies that are coming out, the trial results that are in medical ease, and they'll translate them for the every person, which is a hugely valuable service for folks that are less medically savvy or that English isn't their first language, those types of things. So there's a lot of value in these groups for folks. So let's talk about, knowing that there's study times in this group, their goal is now, because they have this increased amount of information about their condition, is to be a participant in the journey, is to be a collaborator. So, and I will say, the rarer the condition, the more intense and the more of people's personal contacts and friends come out of those groups. And they become your social network for some conditions, for the rarest of conditions. And in rare disease situations, a lot of times, the patient may know as much as the physician does about the treatment because it's so rare. We work with one client where there's 10,000 people in the US with this condition, and an endocrinologist, they see it once or twice in their career. So is the patient gonna, in those situations, probably know more than the physician? Yeah, they are. So that's their goal. Patients' goal now is not to be a part of, take your drug, show up. They're not following directions now. They want to be a player on the team. And that's different. That's a different approach. And that's something that physicians have to understand and embrace. However, the world's changed a lot for doctors too. The demographics for doctors have changed dramatically. People are aging out of the system, retiring. I saw a stat the other day that was 15–17% of the HCP population is retiring in the next couple of years. We're seeing far more women, almost to 50% women coming out of medical school, actually 51% I think coming out of medical school. Far more minorities coming across. So it's a very different demographic audience. And we're also seeing the tech savvy of those doctors coming out is much higher. They're participating in and engaging in social channels. They're consuming information in very different ways. They're also pressed for time. The amount of time they spend with patients has been compressed many times by artificial means. And so they are finding ways to be more repetitious, is that word? Pointing new terms in here. And to get through their patients in a more timely way. So these factors are in contrast with what the patient wants. The patient wants to whiteboard. They want to talk through their treatment options. They want to set objectives for themselves. They want to be an active participant. And the doctors don't have time. So some doctors react well to that and will stay a few minutes longer. And some, and it probably depends on how their day's gone, what time of the day it is, etc., find it very frustrating that the patient wants to have this deep conversation when all I want to do is do a checkup. And I need to see how things are going. Stop talking to me, let me just do my medical checkup so I know where you are. So understanding that dynamic, we know that we have a bit of a crisis of communication. The patients want to be a participant, the doctors may be resistant, and there are certainly doctors that fall on many sides of this, but there's certainly a base of doctors that are struggling to find the time and to be the engagement partner that people are looking for. So let's take a look at this from the patient's perspective. So I'm a member of probably certainly more than 20 patient groups for clients that I work with and healthcare conditions that I follow. And I can tell you the single common thing across every one of those is my doctor doesn't listen. Unfortunately, I think that stems from a lot of things we just talked about. That patients come into an appointment where they're allotted 20 minutes, which is the average duration of physician interaction, and they're looking to have that conversation. I think it's a circumstance that we put ourselves in that these don't align. So it's such a common refrain in these groups that even the admins pull these topics up and pin them as posts about these discussions, how to best prepare for your doctor visit, how to drive a dialogue and engage with your doctor in the best way possible. And they celebrate when people find doctors that interact this way. They share those doctors like wildfire. You're in this metro area and you have this condition and your doctor isn't collaborating with you, isn't listening to you, go see mine. It's an amazing doctor. He or she listens, they engage, they understand what I'm looking for. And that is a huge piece of the journey today, is this movement, and sometimes it's from a generalist to a specialist, sometimes it's just finding the right specialist, sometimes it's finding, even among specialists, like a pituitary specialty endocrinology practice. So it's moving around until they find the right doctor. Now, as we understand this kind of crisis of communication, it impacts how we create content and how we engage with patients. So if we're going to participate, We need to know all of these dynamics and make sure that as Pharma we fit into them. So let's talk about what that looks like and how we can participate. Because it's really critical for us to understand this difference and this collaboration and reflect it in the content we create if we're going to participate. So first things first, we have to be part of the source of credible. We talked about the fact there's a lot of bad info out there. We are one of the most solid sources of info because it's really, really, really heavily looked at to make sure that it's all accurate. Probably no other source of information gets more scrutiny than Pharma. So it's important for us to bring those things up and show them, whether it's how to take your medication, like in the first example here, that there's an interaction with walnuts that can increase the efficacy of the product, or whether it's understanding diagnosis and what kinds of things make you more likely to have a condition. These things are important for us to share as credible sources of information. Now, what's fascinating, we always want to make sure that we're creating content that is imminently shareable. And so it's important to, like the first ad, I've been on this drug for 33 years and nobody ever told me I couldn't eat walnuts. That's a quote from a patient on a social media post about interactions with walnuts. And I can't tell you, we have comments open on this page. I cannot tell you, there were over 15,000 comments on these drug interaction posts, and universally, people said, I've been on this drug for 5 years, 15 years, 20 years, 30 years, and nobody ever told me that walnuts, grapefruit, all of these other things interact with my medication, and I shouldn't take them within 4 hours or shouldn't eat them at all. That's huge. I mean, to be on a drug for that duration of time and never have a doctor or a pharmacist share this information with you, that's a really important role we need to play. Now, what happens with these posts when they're medically credible, interesting, and even kind of fun or dynamic is people take them to the groups and go share them. And so what they've done by sharing that into a group is they have not only endorsed your content as being of value, but they've then added their story to the top of it and added a layer of credibility that as a pharma company we don't get until they take our post and add to it. We also want to make sure we reflect their realities. The first one here is a formula for parents of kids with profound allergies. Not the kids who have a little rash. These are the kids who go to the emergency room, whose parents spend their lives worrying about them, who can't take them to a friend's party because who knows what they're going to be exposed to. So finding ways to be humorous and finding ways to really reflect the reality of the audience you're chasing, whether it's a patient or a doctor, is a huge part of how we're a credible part of this. And a lot of that understanding comes from participating in these groups. So in this instance, we created the worry monster. And one of our artists at Live World actually drew the worry monster, and it's acknowledging the fact that parents worry all the time. It got a huge amount of traction because people were like, exactly, this worry monster is everywhere. He drives me crazy. And the second one is an example of a different way to think about how we create our materials. So if you look at the migraine industry as a whole, a lot of the material is smiley people in bright outdoor places being really happy. So you can go one way and say that's the world you want if you get the right treatment, or you can acknowledge where they are today, which is they're in a room with all the lights turned off because their head is killing them and they can't stand any light, they can't even turn their phone on, and all they want to do is be able to live their life again. So considering where they are and reflecting their reality can also be a way to participate in groups and make sure that you resonate with the audience. Finding unique methods and unique ways to participate. This is an HCP ad that uses an audio tract. So we put this together not long after Clubhouse got a lot of notoriety, and audio became a platform that people were very interested in. We put a series of these together for various clients, and they were wildly successful, outperformed most every post we had done. And so people, once they see the movement in the voice track, so when they click on this ad, the voice track moves, they turn the sound on. We saw quite a lot of success with this in various social channels. We also use Facebook Premiere in partnership. In this instance, the first person in the picture is the leader of the group for this rare condition, the Facebook group, that is the most, it's where everybody is. There are a couple secondary ones that have very little participation, but everybody who has this condition is in this group. She's the leader of the group. She's participating in a webinar talking about self-advocacy and the value of engaging with your doctor. Second one is her doctor. Third one is the author of an association that covers their treatment area, who has written more about the condition than anybody else. And the last one is a patient who's going to give their perspective. So bringing all these folks together to talk about self-advocacy and having good conversations with your HCP. And using Facebook Premiere, because how many of you are familiar with Premiere before I waste your time? Okay, 10 seconds on Facebook Premiere. It's like live. You get all the benefits of live, the reminders, the algorithm bump, all of that stuff. Only you record it ahead of time, run it through MLR, add captions to anywhere you need to make sure you have sprinkled safety in there, roll the safety thing at the back. It's compliant. It's a beautiful thing for pharma. If you want to learn more, give me a shout and I can share more about how we did that. But finding new and unique ways to partner with people, with leaders and influencers inside of these groups, using different content types is a huge piece of success. You can also create content that directly attacks a problem. Like in this instance, doctors and patients not collaborating well. I mentioned the doctor and patient we had in the webinar. We also did a series on them about how they talk to and interact with each other. Using the audio format, how to talk about yourself. Then we took it one step further and we changed the doctor discussion guide on the website so that the doctor discussion guide actually is a conversation between a doctor and a patient with a voiceover who says, now you'll notice here that so-and-so says this instead of this, because this is a way to phrase that a doctor will better understand. So it leads them through how to have a conversation with their doctor and how to participate. And then finally, the last one is a crossover ad. This is a pediatrician and her child who happens to have the severe allergies I was mentioning before. We were able to use this interview with slightly different takes on both patient-focused efforts as well as on HCP-focused efforts. And her talking about being both sides of that and how collaboration with her doctor is so important as both a physician and a mom. It's also important to find new and interesting ways to introduce information, because I don't know about you, and apologies if we have any doctors in the audience, but there tends to be an ego there. And if you go to a doctor and say, you're wrong, that doesn't play well. So finding different ways to get across a message. In this case, they had a vastly different interpretation of how symptoms affected the patients of this condition. So we created a quiz and a campaign called Treatment Burden that was all about helping the doctors understand that their current method of treatment is just not working. It's hard, it sucks, it's tough for the people having it. Because guess what? There was a new product coming that eliminated most of that. So using different ways, using quizzes, that route from social, live in your website, live in your booth at events. So people want, especially HCPs, want to be up on, and you make a leaderboard, and then they want to compete, and they come take your quiz and absorb that information because they want to compete. It's a great tactic that makes gamification a little bit more fun. You can also create simulations that help doctors understand how to talk to patients and what they should do and how to interact there. And the last example, then we have time for a couple of questions, is you can use the walled gardens, Doximity, Sermo, Skipta, to create these challenges or case studies that invite doctors to give their opinion of a particular treatment. Or even give a scenario where this doctor did this, then they did this, then they did this. Do you think they were right? Only thing better than giving them a quiz to test their knowledge is asking them their opinion and giving them a challenge. These kind of techniques work great and are ways to engage doctors and to deliver messages that can be a little bit harder about collaborating with patients and about the things that patients need. So one of the things we can do as Pharma is understand those deep patient needs and translate them into the way that we take and deliver content. So, as I mentioned, my name is Dawn Lacallade. I'm from LiveWorld. We specialize in using social and digital to connect with patients to change behaviors with patients and HCPs to actually change behaviors. So, what questions do you have for me about the stuff we just chatted about? Interesting, not so interesting, real-time feedback, couple, please.
Do you have any tips for getting started in the groups, as being, on the marketing side, and how do we start those conversations or make those connections?
Good question. The question was, what are tips for getting started in the group? So it's a little different depending on how rare your condition is. If you're in a rare condition space, they're somewhat more inclined to welcome you. And that's because a lot of the associations don't support them in the way that big conditions do. They have smaller associations, lower budgets, or their associations are like rare disease associations that aren't about their topic. So they're hungry for medically credible information and participation. So those groups are a little bit easier to collaborate with. But the first thing to do is to send a message in admin and say, here's who I am transparently. And here's what we can offer you, and set up some guidelines. So guardrails, we will answer questions about our product. We will also correct misinformation or not. FDA says we have a choice whether we want to correct it or not, but once we do, there are guidelines, make sure you follow them. Inside of the group. Some groups will allow you to participate, they'll make it clear who you are, and they'll invite people to ask you questions. Sometimes they'll do that on a limited scope. That's a great way to pilot it and build credibility is, hey, we have a new product coming out and we would like to bring an expert in to answer questions from your community about the product. And the best time to do that is right before launch because or right, in the quiet period before you really launch marketing materials or just as you launch marketing materials, because you're giving that credible information about it, and that drives the dialogue inside the community about the product and about considering change options for the product. So sometimes doing like an event like we did where we brought in the key influencer can be a big help. Sometimes collaborating with some influencers and creating micro-influencers is the approach. But the first place is to start with the group champions, be candid, be humble, and set out the guardrails yourself so that they don't have to. I will not spam people with messages about my product. I will not answer questions that are not directed to me about my product. I will not set those limitations so that the admins feel comfortable. Other questions? Please.
How do you see HCPs changing their behavior using social media? Are they taking social media to advocate or create these groups? And is that changing in certain area?
Oh, yes. So the question, in case you couldn't hear it, is, are HCPs participating in groups? How are we seeing their behaviors change? Dramatically change. When you have a minute, go to Facebook and search oncology. There are 50, 75 groups of doctors collaborating. Everybody's like, ooh, I have my phone. I'm going right now. Collaborating about oncology. Oncology doctors creating their own Facebook groups so they can collaborate around their topic of interest. And they're robust, and they're doing behaviors that are very much like the ones we talked about with patients. They're involved, they're sharing information. They're sharing conversations about not just some of the value we see in some of the walled gardens where, like, for example, in Sermo, you can rate, physicians will rate medications, but they're actually having conversations about how to transition your patient between medications, things like that that we, as Pharma, don't usually address. So absolutely they are. There's a huge uptick in participation in walled gardens. Sermo skipped Doximity, Figure 8, all of those. As well as we're seeing them create groups of their own. There are a lot of groups showing up for the larger practices. For oncology specialty regional clinics, there's collaboration among the people in a clinic, as well as with specialty areas across them. So yes, there's a huge participation. And it makes sense with COVID, that's driven so much higher because we didn't have the opportunity to, like we didn't have professional growth as much in those situations. They didn't either. Other questions? Great, well, thank you guys for your time. Appreciate it.